Let's talk about self-diagnosis. If you know and follow my content, you might expect that I'm going to be against it, but I am actually not. I am not against self-diagnosis in principle. I am not against self-diagnosis in general. I am against self-diagnosis based on online content such as you can find on this app, the other app, various apps. The kind of content where put your finger down if X, Y, Z. The kind of content where I just found out that doing this behavior, which is a fairly common behavior, is a sign of this condition. Oh wait, it's a sign of the other condition. Or maybe it's a sign of 5 different conditions together and perhaps you have them all. That is what I'm against. Because in mental health, differential diagnosis matters. Differential diagnosis is when we distinguish between different conditions, because very often there is different treatment that may be necessary for different conditions. And honestly, if you are not looking for treatment, you're not looking for a diagnosis, you're looking for identity, and that's a whole separate conversation that I am just not going to have right now. So if you are looking for a diagnosis, presumably you also want help with your condition. And in that case, eventually you are going to need to confirm it with a professional who can provide help for your condition. If you're just looking for advice for how to deal with specific symptoms or issues, like for example with executive dysfunction, that doesn't really matter if you have the diagnosis or don't have the diagnosis. You can still use the advice. The advice will apply regardless of what's causing the dysfunction. You don't need the label. You just need to address the behavior. You need to get help with how to manage that. People are looking for the diagnostic label because people feel like there is something wrong with them. And very often something is wrong with them. They are struggling with something and they're trying to figure out what that is and trying to give it a name, and they're trying to be able to use some kind of a shorthand to explain it to other people. That's also another reason for seeking diagnosis, and that's okay, except again, it's very difficult to do differential diagnosis properly by yourself. And yes, our health system is terrible and it's difficult to get proper diagnosis, and medical professionals are not always doing it properly either. I get all that. I just want you to be careful with what you do, because sometimes people become really attached to a label that they've decided on, and it just really is not what their issue is. It may be something else and they stopped looking, and therefore they may not be getting the help that they need, or they may not be finding the solutions they need. That's all. Use your critical thinking and don't go by what you see in the algorithm, because it's going to keep showing you stuff that will reinforce the confirmation bias, that will make it more and more seeming that that's it, you found it, because that's what it's going to do to you. And that's not going to be about you. It's going to be about what you liked and what you've seen. It's what happens in this place. Think about that.